On your health tonight, a local cluster of patients testing positive for tuberculosis. Health officials in Brockton now confirming at least 10 active cases in recent weeks. Here to answer your question is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Always good to see you, Doctor.
Good to be with you both.
And Dr. Ellerin, Good Samaritan Hospital told us today that their doctors treated 4 patients and all have been released. You didn't have any at South Shore, but health officials are telling us the cases are unrelated. And why is this important?
Well, it's really important, Jennifer, because, TB is serious, it is contagious, but I want to be clear, there's no community spread in Brockton right now. There's about 10 cases or so, but in any given year, they see about 10. In any given year in Massachusetts, we see about 150 cases. But I can understand at Good Samaritan, they're seeing 4 active cases right now, and again, it is very intensive. The good news is that they're getting a lot of help from local Department of Public Health and Board of Health in Brockton. They're excellent, collaborating with the State Department of Public Health and different institutions that specialize in tuberculosis. They're working hard to make sure that this doesn't get out of hand.
Right. And we know you've treated patients with TB before. What can you tell us about the symptoms?
Right. So I'm glad you asked that. The bottom line is there's 2 different types of TB. There's latent TB, people who initially get infected. Those people don't have any symptoms. And you may not have symptoms for years. In fact, the good news is that most people never develop active TB. Now, active TB, the contagious type, is typically cough, but a cough that lasts more than 3 weeks. And not just a cough, but a cough usually with fevers, night sweats, weight loss. There's a lot of systemic symptoms. So it looks different than your classic flu or bronchitis.
And hospitals are already bracing for a seasonal surge of COVID-19, of course, RSV and the flu. Is there any risk we could add TB to that mix too?
Yeah, that makes sense, right? Because winter's coming. As you crowd more, there can be more TB. But remember, RSV, COVID, flu, these are very contagious over short periods of time. With TB, I talked about that latent tuberculosis. There's time for surveillance to get in there and really manage the close contacts. You can actually treat them before they develop active TB. That's why there are much fewer cases. I'm not really concerned. Help is on the way.
Good to know. All right, Dr. Ellerin, always good to see you. We appreciate your insight.
You too.